Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So before proceeding to the topic, kindly like it, share it and subscribe it. So today we'll be seeing about sampling technique. So sampling is a process of selecting representative unit from an entire population of a study. In simple words, we can say that, for example, I am going to a grocery shop. I wanted to buy a 25 kgs of rice. So in a bag full of rice, I will take only a handful of rice and check their quality, color and their texture. So I cannot check the entire bag, rice bag, isn't it? So I will take only a small handful of rice and check the quality and everything. In the same way, a chef wants to taste a particular dish. That chef will not completely eat those dish. He or she will take only a scoop of spoon from that dish and taste, and they will give the judgment. In the same way, the pathologist who wants to check the hemoglobin level in a person's body means he will take only few milliliters from the body and check the hemoglobin level, rather than he will not check the entire blood of the individual. That is known as, in simple term, sampling. That is a process of selecting a representative unit from an entire population. So when we are proceeding in the research, we cannot do the research for very entire population. So even doing the research for the entire population is very difficult. So there we use a technique known as sampling. So we'll see one by one in detail. The way in which we select a sample of individual to a research participant. If we do poor job in sampling stage of research process, the integrity of the entire project is at risk. Sampling is a process of selecting representative unit from an entire population. It is not always possible to study an entire population. So therefore, a researcher draws a representative part of a population through a sampling process. So when a researcher wants to study a particular population, he cannot do a study for the whole population. Rather than he will select some of the representatives from that population. That is known as sample. So whatever the result we are getting from that sample, it can be generalized to the whole population. So in simple term, that is known as sample and sampling technique. So if we are proceeding in a proper way, that is a proper selection of the sampling technique based on the research study, then only our research will get a proper inferences and we can draw the proper conclusion. If not, we are proceeding in a proper way, it will become as a cumbersome process and it will take our time, and also it causes the wastage of resources, wastage of money and everything. So definition. Sampling is a process of selecting a representative segment of the population under study. That means it is a process of selecting a particular amount of sample from a whole population. For that means they are going to represent the population. So whatever the inference we are getting can be generalized to the population. Next is purposes. To gather data from the population in order to make an inference that can be generalized to the population. So here the sample is selected from the population. Maybe there is 1000, 100 or 1 lakh million populations. From that we are selecting only particular amount of samples according to the need of the researcher by employing some of the techniques for the sampling. So these are all the main purposes of sampling. So when we consider about the population means, for example, I am going to study the Helfer skin tap technique is going to be effective for the toddler age group to reduce the pain while giving the IM injection. So I cannot select whole population the toddlers. Only a few numbers toddlers can be selected and that inferences can be generalized to the whole population, and I can say that this technique is effective in reducing the pain in the while administering IM injection to the toddler population. So whenever the toddler person come to my clinic to have an injection, I will use that technique in order to draw the conclusion that it is going to be effective for all the age group of toddler. The purpose of sampling is to provide various types of statistical information of a qualitative or quantitative nature about the whole by examining few selected units. So this has some of the sequences. That means first is process of sampling, define the population, which population I am going to choose. I will first define it, then develop a sampling frame, Then select a sampling method. Which sampling method I am going to select for the population or the sample. Next, determine the sampling size. Next, execute the sampling process. So we have a broad classification of sampling techniques, that is probability sampling techniques and non-probability sampling techniques. So we will see about each and every techniques in detail. First we will see probability sampling technique. Under probability sampling technique we have simple random sampling, stratified random sampling, systematic random sampling, cluster or multi-stage sampling, or sequential sampling. So we will see these all subtypes of probability sampling technique in detail one by one. So for each and every sampling technique we will see the examples and everything. So the probability sampling technique in simple term means all the individual have the equal chance of getting participation in the research study. Next is non-probability sampling technique. Here the subtopics are purposive sampling technique, convenience sampling technique, consecutive sampling, quota sampling, snowball sampling, and volunteer sampling. So non-probability sampling technique means here all the persons under the study will not get the equal chance of getting participating in the research study. Next is features of probability sampling. The technique probability sampling involves sample to be gathered in a process that provides equal chances to all the individuals in the population of getting selected. So here all the population will have an equal chance of getting selected, hence the bias will be very minimal. So we can prevent the bias in the research study because all the individual have the equal chance of getting participated. So according to the sampling we will select the sample size. Next is we will see about the simple random sampling. So in simple random sampling again it is classified into first is lottery method and next is tables of random number. So lottery method means, for example, I am going to select some of the students for the research study. So what I will do is I will write everyone's name in the paper, or I will allot the number to each and every student in the class and I will put in the box, and then I will draw the box and take the sample. So that means that every individual's name is inside the box, so everyone have the equal chance of getting participating in the study. That is known as lottery method, that is drawing out their names and picking up the sample from that lottery. That is known as lottery method. Next is tables of random number. Tables of random number means I will just arrange their names in an order, then randomly by the tables I will select the samples. Next is stratified random sampling. So it is a method of probability sampling in which the population is divided to different subgroups and samples are selected from each of them. For example, I wanted to select a age group, adolescent age group of 16 to 18 years. So I will make a group. So there will be about 8 to 10 groups. From each 10 groups, I will select the sample. So that is known as stratified random sampling. So here also all the study participants have the equal chance of getting selected into the research study. So that is known as a stratified random sampling. So here what happens is from each group I will select according to the need of the researcher, either one person or two person or three persons, like that. Next is systematic random sampling. It is a method of probability sampling in which the defined target population is ordered and the unit of sample is selected at random, and the rest the sample is selected according to position using skip interval. So K is equal to capital N by small n. That means K is a skip interval. So capital N is a population size, NN is sample size. So among the population, how much I am going to select the sample. So for example, a researcher wants to choose about 100 subjects from a targeted population of 500. So therefore, I will divide the 500 by 100 is equal to 5. That means among each fifth interval, I will select the number. For example, first member, fifth member, 10th member, 15th member, like that. That is known as systematic random sampling. Next is multi-stage sampling. So cluster sampling means random selection of sampling units consisting of population elements. Then from each selected sampling unit, a sample of population element is drawn by either a simple random selection or stratified random selection. It is used where the population elements are scattered over wide area. So multi-stage sampling means first I wanted to do the study on the pregnant mothers. So I will select the pregnant mothers. Then my choice is to select the primary mothers. Then I will divide that pregnant mother into primary mothers. That is, first stage is selection of pregnant mothers. Second stage is selection of the primary mothers. So this is known as multi-stage sampling. So based on the need of the researcher, he will divide the group into various stages, and then according to their sample they will select from the population. So that is known as, by different stages we will select the sample. That is known as a multi-stage sampling. That is, from a population a sampling unit is being drawn. So that is the main example I have given is, first we will select the pregnant women, then among the pregnant women I will select the primary mothers. If I want primary means I will select the primary, so that is second stage. If I want multi-para means I will select the multi-para. So based on that we will categorize the sample from the population, then we will proceed into the research. So for example, we will see in the image. So sample, we have various groups, right? So first group may be a stage 1, then stage 2, then stage 3. So based on the need of the researcher, the staging is done. Next is sequential sampling. So this method of sample selection is slightly different from other method. Here sample size is not at all fixed. The investigator initially selects some small samples and tries out to make inferences. If he or she is not able to make result, then adds more subjects until clear-cut inferences can be drawn. So increasing sample size until the inference is drawn. That means that the researcher first of all will select only the small samples. Then he will do the research study and he will find out the inference from that. If he is not satisfied with the inferences or the conclusion drawn from that, the researcher will add upon the sample size. So until and unless he gets the proper result, he will go on adding the sample size. So that is known as sequential sampling. So for example, he wants to study on the renal transplant patients. So he is not getting the proper result means he will go on adding the patients one by one. So that is until and unless the researcher draws a proper inference or conclusion, whatever the researcher want, until that he will go on adding the sample size more and more. So that is in simple term known as sequential sampling. So next we are going to see the next broad classification, that is non-probability sampling. So it is a sampling technique in which the samples are gathered in a process that does not give all the individuals in the population equal chances of being selected in the sample. In this method, every subject does not have equal chances of being selected. So first one we are going to see the convenience sampling. It is based on convenience of the researcher. The sample taken from a group of people easy to contact or reach. For example, if you are standing at mall or grocery shop and asking people to answer the question would be an example of convenience sampling. So based on the convenience of the researcher, when he is on doing the research study, who and all comes to that particular place, he will take that person's as their sample, because it is for his convenience, that is a researcher's convenience, as well as they are in a very accessible reach. That's why it is known as a convenience sampling. So from the word itself it is very clear, based on the researcher's convenience we are doing the convenience sampling. And the same way, whatever the study we are doing in general, who and all are there in that particular place during that sample collection, they are and all comes under this sample. So that sampling technique under non-probability is convenience sampling. Next we are going to see the purposive sampling or judgmental sampling. So depends exclusively on the judgment of investigator. Some degree of bias will be there. So samples are chosen by choice, not by chance. So based on the choice of the researcher, here the sample is being selected. So for example, a researcher wants to study the lived experience of post-disaster depression among people living in earthquake affected areas of Gujarat. So here the researcher purpose is to select those people who fulfill the criteria. So who was there in the post-disaster, who and all has the post-disaster depression, that is he is going to assess the lived experience. So his main choice is to select, his main purpose is to select the persons with post-disaster trauma. So hence it is known as a purposive sampling techniques. Next is consecutive sampling technique. So it is similar to convenience sampling. It seeks to include all the subjects that are available. For example, the researcher wants to study the activity pattern of post kidney transplant patients. He can select all the post kidney transplant patients who meet the designed inclusion and exclusion criteria. So it is also somehow similar to that of convenience sampling. Next is quota sampling. The researcher ensures equal or proportionate representation of subject depending upon which trait is considered as a basis of quota. For example, the quota is college level. The researcher needs equal representation with sample of 100. He or she must select 25 from the first year, 25 from the second year, 25 students from the third year and 25 from the fourth year. So sample selected without random process from different quota. That is known as quota sampling. So that is different in different quotas we are going to select the sample. Next is snowball sampling technique. The researcher identifies the subject in studies where subjects are very hard to locate. So for example, the researcher wants to study on prevalence of HIV AIDS among the commercial sex workers. It works like chain referral sampling. So chain referral means like it also have again classifications of linear, exponential discriminative, exponential non-discriminative. So here what happens is we cannot find the commercial sex workers very easily. So what happens is they will refer the other persons according to their profession. They will refer the other persons. That is known as a chain referral sampling. That is snowball sampling. First we will see the linear. So linear means what? It is a straight line. So he will refer the one person. For example, I am going to collect the information from one of the commercial sex worker. That person will refer the other. That is known as linear. That is single person will refer the each and single persons. Next is exponential discriminative means so one person will refer two persons. Among that two, only one will be selected as a sample. That sample will again refer the two persons. Among that two, only one will be selected as a sample. So next is exponential non-discriminative. That means I am going to select one sample. That sample is going to refer the two persons. That two persons will be included in the study. In the same way, that two persons will again refer another two persons. That means all the persons will be included in the study. That is exponential non-discriminative. So the advantages of the sampling technique is it provides the in-depth knowledge, cost effective, reliable, and it is very accurate. It provides a less opportunity for the manipulated data. It is evenly distributed sample we can use and make sense for infinite population. Means that I can generalize the whatever the inferences I am getting, I can generalize to the whole population. So that is known as the some of the advantages of sampling technique in the research study. So when we do the proper sampling and sampling technique, majority of the research study gets completed. Next is disadvantage. That is sometimes a lack of representativeness can happen if we are not selecting the proper sample from the population. Next is there is a chance of sampling error if we do not have the sound knowledge on sampling techniques. Inadequate subject knowledge. If a researchers have a very less subject knowledge related to research, then it is very difficult for them to identify what sampling technique has to be used for which research study. Next is unscientific sampling. Same, if a researcher is not able to conclude what technique has to be used and how properly it has to be utilized, then it will become as a cumbersome process in the research. So only we have to do a proper sampling. So if we do the proper sampling only, we can generalize those inferences or conclusion to the whole population. So far we have seen about what is sampling, what are the sampling techniques. So again the sampling technique is broadly classified into probability sampling technique and non-probability sampling technique, and we have seen each and every sampling technique in a very gist form. I will explain about how to identify the sampling for each and every study in another video. If you like this video, kindly like, share and subscribe it. If you have any doubt, kindly drop down in the comment box. And if you want me to take any other topics, kindly give me suggestions for taking other topics in the forthcoming videos. If you have any doubt, kindly drop down in the comment box. Thank you for watching.